So what is the driver? What is the tension for change in healthcare right now? We should change because the current state is not affordable for any of us, for providers, purchasers, health plans. So if we wish to survive and to thrive, we need to invent the next. We need to get together, and that's very important that we do this in a collaborative fashion. We need to get together to invent a better healthcare delivery system for ourselves and for our citizens.
What is the state of healthcare at this point? It's volatile, it's variable, it's shifting, and really you have to stay ahead of the changes and ideally participate in those changes that are coming down the pipeline.
There are several reasons for the transformation in the delivery of care. The first group relates to quality and making that quality more consistent. The second group relates to cost and making that cost as low as it can be and still get the same outcomes. That's important both for individuals and for our entire culture so that we can spend some of that money on other things such as education and social services.
To begin improving affordability of healthcare, the first task is defining quality. There are many definitions of quality, and I found the most useful definition of quality comes from the customers, the employers that purchase healthcare.
Value-based care means the highest quality at the lowest cost.
Value-based care means being able to transform care.
Value-based care for the City of Kirkland is really centered around our employees. And it's around these principles of savings and information and making sure primary care is always available to them.
Value-based care means identifying and rewarding value in the delivery of healthcare.
From the provider perspective, it would be helpful if a purchaser recognizes the importance of that partnership. There will be activities that the purchaser can do much more readily that a provider system cannot. Through partnership and value-based care contracts, it establishes the relationship to allow for those activities to happen, where there's not a duplication of efforts, but a singular effort in the areas of expertise.
You know, the power for change for affordable healthcare comes with the purchasing power of the employers. They pay the salaries of the health plans, they pay the salaries of the providers, and they can bring out the best in each of those two suppliers. So for a purchaser to actually use their purchasing power to drive change, they need to specify the quality indicators in their terms. They need to understand the medical conditions that are most important to their employees, and only then can they apply their purchasing power to secure the care they need for the employees that they serve. You should be taking better care of those financial resources, and you should be procuring health care with the same care that you buy other goods and services.
In order to make it as easy as possible for health systems to provide high quality care, what purchasers can do is to have what they purchase create incentives for their employees to do just that, and to create conditions that make that task easier for providers.
For the City of Kirkland, and for, I would think, any institution, the health of your employees is priority number one. The message I would say is there are real substantive things you can do to create an environment that improves the health of your employees, not just say we're going to take necessarily what the health system provides us.
The concept of return to function through a value-based approach is very likely. Through focusing on health outcomes and improving quality, we can have a return to function and getting our patients back into the workforce and contributing to the economic base of our region. The decisions that purchasers make affect their members, our patients, through significant ways. Whether it is access to a referral or specialty service, whether it is access to a particular medication, any of the decisions that a purchaser makes directly correlates to the healthcare decisions that we contribute to as a provider.
you can take action to provide value that will have a real, meaningful, measurable improvement in employees' health. And that's what we're talking about here when we're talking about improving value for employees.
Value-based care is important for purchasers as well, and it's worth pursuing. It's worth pursuing both because of the improved function and life experience of patients and employees and the reduced cost.
Value-based care is important to the health of a region and a community because it allows the provider system to focus on population health. I like to say that's a marathon, not a sprint, in that it takes a long-range vision to improve health. A value-based care contract allows the provider to have the resources necessary to serve the population to achieve population health goals.
The models we're using now for value-based purchasing not only take the direct costs of healthcare down, they mean that people are back to work much more rapidly with higher patient satisfaction. So what we like to say is better, faster, more affordable.
Just before I got here, the city had moved into a self-insured model, which was a critical first step for our city because it gave us the kind of flexibility that we needed to try to do something, to try to make a plan design change that would be specific to whatever our strategies were. The results here at the City of Kirkland have been significant. I don't want to overstate them because we've only been doing it since April of 2015. We are not the largest sample size in the world. But we have seen an increase in utilization. We've seen a decrease in specialized referrals. We've also seen a reduction in trend. And remarkably, I think we've seen an increase in savings. So it's tough to put all that in one basket and not feel proud. Again, it's early days, but I think the principles behind the model seem to be taking effect.
So change is difficult. Change in healthcare is difficult. But I would simply ask purchasers, are you content with the current state? What is the current state doing to your employees? What is the current state doing to the financial performance of your company? If we want to invent the next, and if we want to survive and thrive, we're going to have to do something different.
A healthier Washington is where you have engaged partnerships between payers, provider systems, legislators, and communities on a shared vision around what health means to all of them.
You know, my advice to other organizations who are interested in pursuing a value-based approach, but are feeling that the challenge might be overwhelming, is to reach out to the community of organizations that are doing the work now and become part of that shared practice. And take the time to learn the details, take the time to learn what's working, take the time to learn the challenges, because there are challenges. But if you get involved in that community, all of the challenges and the change seems much more manageable. And then you can start to feel and see all the powerful benefits of the value-based approach. And I think with that information and that inspiration, you will affect change.